All right. So the main objective of today's webinar is to discuss how to actually enter, edit, and submit data into the new Health Services Report. This is the second training in this series. The first training discussed more basic concepts such as what is the Health Services Report, what is the DHIS2, why are we making this transition, who is impacted, things like that. If you are unable to attend one of the first training sessions, do not worry, because we do have a number of materials that go over those topics available to you, and we'll discuss some of those materials in this training. But again, the main objective of today is to actually show you how to enter data into the new Health Services Report. So we'll get right into it here. To access the DHIS2 and the Health Services Report, you can go to www.psi-mis.org, where you can enter your login credentials, your username and your password. Everybody should have set up a user account by now. If you had any problems or issues setting up your account, please don't hesitate to reach out and let us know. If you forgot your password, you can click on Forgot Password below the Sign In button, where you'll be asked to enter your username and click Recover, and you'll be walked through how to recover that password. And if you have any problems initially logging into the system, you can also submit a help desk ticket directly from this page here by clicking on this link which says Help Ticket right here. That will take you to the Submit a New Ticket Request page, which we will discuss in more depth later in this training. You can actually also access the knowledge base directly from this page by clicking on the knowledge base right here. And that will take you to the main support center for PSI, where you can access information about DHIS2, about the Health Services Report, and more. And we will discuss this page in more depth as well in just a minute. So begin by logging into the system. Just click Sign In, and that will take you to your home page, which will look something like this. Everyone's home page will look a little bit different depending on what country you're logging in from, or what country you have access to. Right now, I'm logged into a demo account that has access to data submitted for Kenya. And what we're seeing here on this home page is a dashboard that's based on 2013 service data that was submitted through the Health Services database. And depending on what country you have access to, this dashboard will display data for that country specifically. So I'm logged in as Kenya, so I can only see Kenya's data. If you did not submit any 2013 data through the Health Services database, unfortunately you will not see any data represented here. But right now, because we don't have any data submitted through the Health Services Report, we had to use a data set that was available, which was 2013 service data. So we apologize if you can't see any data here, but over the next coming months and the next coming years, as you do submit data into the Health Services Report, we will generate new dashboards and new views. So over time, your home page will become populated, even if it's not populated right now. Future training sessions, future webinars will discuss how to generate and create your own dashboard and how to share it with your colleagues. But for now, we're going to discuss how to actually enter this data. So before we jump into that, I want to orient you to a few more things on this homepage here. The first is this DHIS2 logo in the upper left-hand corner of your screen. This is a link directly to your homepage. So no matter where you're at in the DHIS2, it will always take you back to this homepage. If you ever get lost or get stuck and you just want to get back home, this button will get you there. The other features that I wanted to point out were the Profile and Apps menu in the upper right corner of your screen. The Profile menu is where you can go to adjust your language settings, fill out your profile, or change your password for the DHIS2. To change your language settings, you click on Settings, and you can choose your interface language from English to whatever language of your choice. Click on the Profile button to fill out basic information about yourself and your profile. You can include your email, your phone number, you can introduce yourself. These fields are not mandatory, but they do help keep the system up to date. It helps us know who's using the system, and it helps facilitate communication so that we always have your updated email address on file. The Account button here will take you to a page where you can change your password. Really very straightforward. So that's the Profile drop-down menu. The Apps drop-down menu is where you'll spend, I think, most of your time. There are a few key applications in this menu that I wanted to discuss. Data entry, we're going to spend most of our time in this training series in the data entry module. But from the Apps menu, you can also access the PSI support and the data dictionary. So before we jump into the data entry module, I want to chat about the PSI support system first. So if you click on this button here, it will take you to PSI's Support Center here. Like I alluded to earlier, the Support Center here has a lot of resources available to help you learn about the DHIS2 and the Health Services Report in particular. So we really encourage you to go onto this site and browse around. One way to access information is you can actually type a search parameter into the search field here, and it will return a listing of any articles or content related to your search term. Or you can simply browse some of the articles. At the top of the page, we have some general announcements about the DHIS2, some frequently asked questions. But if you scroll down just a little bit more to a section called Knowledge Base here, you'll see that we have 4 sections dedicated completely to the Health Services Report. Here's where we have Health Services Report module guides, which walk through each data entry form in the Health Services Report, table by table, tab by tab, explaining why it's important to collect the data that we're asking you to collect and how that data is disaggregated or broken down. We'll discuss the module guides in a little bit more depth once we actually take a look at a data entry form in just a minute. Here we also have Health Services Report training videos, and these are actually a really neat resource. Right now we have 4 training videos posted. The first is an introduction to the Health Services Report, giving you some of the background information that was discussed in the first training series, or in the first training session. Video 2 goes into depth about this support center here, the knowledge base, and how to access help desk resources. Video 3 discusses how to access the DHIS2, what to do if you forget your username or your password, how to log in, things like that. And then video 4 discusses what we're about to discuss very shortly, which is how to actually enter data into the Health Services Report. These videos are all posted on a YouTube channel and are publicly available right now. So you don't have to download the video, you can actually watch them right on YouTube. So this should take us to a YouTube page with this playlist of 4 videos. And I'm going to copy this link. Oh no. Alright, I'm going to pause this. Pause. Sorry about that. I am going to type this link into the chat box so that everyone can access this training video playlist. So please browse those at your leisure. They're pretty short videos. They range between 5 to 8 minutes, but they're very easy to sit through, very easy to get through, very accessible. All right, so back to the support center and the knowledge base. So those are the training videos. We've also posted all of the communications that we've emailed you about for the health services report. So pretty much any of those infographics that you received in your inbox, those are all going to be posted here. So you don't have to go digging through your email every time you want to access one of these. They're all right here. And then finally, we have a link for common data element definitions. And a data element is basically a data entry field. And the Common Data Element Definitions article discusses some of the more common terms that you're going to find in the data entry forms, such as what are service delivery channels. Here you can find very clear definitions for franchise facilities, service delivery partners, and what we mean by PSI direct service delivery. You'll also find definitions for channel type, fixed and outreached, marital status, gender, and residence. So these are just some of the more common terms and definitions that you'll encounter when you're entering data into the health services report. And that can all be found on the knowledge base on the support center. The last thing that I want to show you before we actually take a look at a data entry form is how to submit a ticket request. There's a link in the upper right side of this page that says submit a request. And this will take you to the submit a request page. We ask you to fill out some very basic information such as your email address, your name, and the country that you work in. Provide a subject. And then most importantly perhaps is the ticket type. The ticket type is going to determine who receives your ticket. And we've set this system up in this way so that your question or your technical issue gets addressed by the right person the first time so that we can be as efficient as possible when we're answering questions or addressing technical issues. If you have an issue that is technical in nature, a data entry form won't load, the page looks funny, you don't think your data is saving properly, DHIS technical issues will be directed to the MIS team. If you have a question about a specific module, such as contraception or maternal health or HIV, you can select one of these two options, and these questions or queries will be directed to the technical teams, such as SRHT. If you have a question about how health impact is generated, if you have a question about referrals or how we attribute impact, you can click this option here, and these questions will be directed to the program analytics team. And finally, if you have any questions about how to adjust your local data collection tools or databases to meet the needs of the new health services report, these questions will be directed to your M&E regional advisor or to the MIS team. As you'll see, when we open up some of these data entry forms, we are asking you to collect some new information that you might not be currently set up to collect, and we understand and we appreciate that. So we are here to help provide support as we make this transition so that it is as smooth as possible, as smooth and efficient as possible. Finally, we ask that you provide a description of the issue that you're having, and you can even include an attachment to help clarify your problem. If you're having a technical issue or something like that, you can take a screenshot or even a short video and include it here to be as clear as possible. Then you have to verify that you are human and click submit, and your ticket will be addressed as quickly as possible. So that's the ticket system. We hope it's easy to navigate, and we hope that you use it. All right. So we've talked about the support tools. Now let's actually take a look at data entry. To begin entering data into the DHIS2, from your home page, you can go into the Apps menu and click on Data Entry. Once you click on Data Entry, it will take you to the Data Entry module, which I've loaded right here because my internet connection is just kind of poor, so I've loaded it beforehand. In order to complete or fill out data in the health services report, you need to adjust or set three key parameters: the organization unit, the data set that you want to enter data for, and the period. Let's start with organization unit. An organization unit is basically a geographical unit at which data is entered. The health services report sits at the country level. So you will not be able to submit data for the health services report at the provider or the district or the regional level. You will be able to submit data for the health services report at the country level. To select your country, there should be a tree map on the left side of your screen. Most of you will only have one country that you'll be able to see here. If you have multiple countries, simply select the country that you'd like to enter data for. If you see the wrong country, submit a ticket to Help Desk and let us know. You can access the ticket system by clicking on Apps and PSI Support and following the steps that I just discussed. So we've selected Kenya because that's the country that we've selected for this demo. And once you've selected your country, you can actually hide the side of the page by clicking on that left arrow and give yourself a little bit more space. The next key parameter that you have to set is the data set. In DHIS2, data sets and data entry forms are very similar terms. A data entry form is simply the graphical representation of a data set. It's how you enter data into a data set. In the Health Services Report, there are 7 data sets. Each data set corresponds to a specific health area. So we have cervical cancer, contraception, HIV testing and counseling, maternal health services, sexually transmitted infections, tuberculosis, and male circumcision. Each data set is tagged with an HSR in its title. So we're going to use HIV testing and counseling for our example here. The final step in this process is to select your period, or the time frame for which you want to enter data. Now, it's very important to note that the data entry form will be open from the 1st through the 12th of the month. After the 12th of the month, the data set will be locked, and you will not be able to enter or edit data. So here I can see previous months like May, June, or July, and I can load the data entry form, but I will not be able to enter or edit data for those months. I can only enter or edit data for the current reporting period that is open. So we're going to select September to open up our data set. All right, so once you've filled out those parameters, the data form should load. This may take a few seconds depending on your internet connectivity, so just give it a few seconds. If it doesn't load after several minutes, you can submit a ticket to Help Desk, but it should load. And each data entry form has a number of tabs and a number of tables. It's broken up by tabs to make it easier to navigate. Right now we're on the Testing tab, and the first table that appears is individuals tested for HIV by age and gender. So this is where we're going to start entering data for this example. We're going to click on the first field here, and in order to enter data, you simply click on the field, type in the data point that you want, and then once you click away from the field, it will turn yellow and then it will turn green. A green field indicates that the value has been saved. And if you're online, if you're connected to an internet access or an internet connection, it will be saved to the DHIS2 database. If you are offline, the data will be saved in your local cache system. To upload that data that you've entered offline, you simply need to find an internet connection, open the data entry form, and it will ask you if you want to upload the data that you've stored locally, offline. Simply hit yes, and it will upload your data. If you have any issues with that system, please don't hesitate to submit a ticket to Help Desk. So again, once the field turns green, it's saved. You can move on. If you want to edit your data, you can absolutely do that. simply click on the field, edit your data, and then once you click away, it will turn yellow and it will turn green again. And again, green means that it's been saved. If you enter an invalid value, like a character, where you're only allowed to enter numeric values, you're going to get a pop-up that explains the problem. This value must be a number. Simply hit OK, and you can correct the value. Click away again, and the value turns green. It's been saved. If you want to delete a data point completely, you can highlight that data point, click backspace or delete on your keyboard, and then once you click away, it will turn yellow and then turn green again, and then the deleted data point has been saved. You have no data in that data field. And it's pretty much that straightforward. It's that simple. You can continue through the rest of the tabs, entering data where you have it and where it's appropriate and required. If you have any questions about the tables themselves or about the tab that you're in, this is where the module guides become a key resource for you. The module guides break down every table within every tab of every data entry form. And they explain why we're collecting this data and how it's disaggregated. From here, you can access the module guides in one of two ways. You can click on this Ask Here button, which will take you to a new ticket request. And then from this ticket request window, you can click on the PSI logo in the upper left-hand side of your screen, and that will take you to the Support Center, where you can access the module guides. Alternatively, you can click on the Apps menu, click on PSI Support, and this will take you directly to the home page of the Support Center. Here we go. Scroll down a little bit and you have your module guides. So right here we don't see HIV testing and counseling because it only allows 6 entries to view. But if we click on See All 7 articles, it will take us to the full listing where we have HIV testing and counseling. If we want to take a look at this module, you'll see that it breaks it down and explains why it is important that we're collecting the data in this data entry form. And then it goes one step further, and it breaks down every tab and every table in the form. So here we have tab 1, testing, and then the first table that appears in that tab, individuals tested for HIV by age and gender. And as you can see, tab 1 is testing, and the table is individuals tested for HIV by age and gender. So this explains what the data table is capturing, what is broken down by, and why all this stuff is important. And again, this is available for every tab, every table, every data entry form. So we really encourage you to take a look at these module guides and share them. This is a shareable link. You do not need to be signed in to access this link. You can paste this into an email if you like. The other really key resource to help you navigate these forms is the data dictionary. And there's a link in every tab of every data entry form to the data dictionary in the upper left-hand side of the screen. Clicking on this tab, or this link, will take you to a listing of data elements specific to the tab that you're in. So right now we're in the testing tab. We're going to click on data dictionary. It's going to take us to a new page. And if my internet connection works, it will take us to a listing of data elements specific to the HTC data entry form in the testing tab. As you can see, there are 2 core data elements in this tab, individuals tested for HIV as individuals and individuals tested for HIV in couples. The data element description explains exactly what that data element is capturing. In this case, the data element is capturing the number of individuals who were tested for HIV and received their test results. The descriptions also provide descriptions or definitions of how the data element itself is broken down. In this case, it's broken down by age and by gender. So if we go back to our data entry screen, we'll see that we have individuals tested for HIV as individuals here, which is our core data element. And then it's broken down by age and by gender. And again, that link is specific to each tab. So this link is going to take us to a set of data elements specific to this tab. If you'd like to access data elements for the entire data set or data entry form, that's pretty easy to do as well. From the data dictionary, you can simply click on Search by Dataset and then pick your dataset from the drop-down menu. And remember, all datasets for the Health Services Report are tagged with HSR in the title, so they're very easy to find. If we click on HIV testing and counseling and click Get Data Elements, this will take us to a listing of every data element in the HTC form. It's going to take a little while for it to load because my internet connection isn't that great and there are a number of data elements, but it will load. And when it does, you can download that listing to Excel or PDF so that you can save it or share with colleagues. So all right, you've entered your data. You've used the resources, the module guides, and the data dictionary to help you determine exactly what data to enter where, and you're ready to submit. You're ready to finalize. In order to finalize, there are two key steps to take. The first step is this Run Validation button in the upper right corner of your screen. This is going to run your data set or your data entry form against a number of validation rules. A very good example of this is you cannot have entered more individuals testing positive for HIV than you can have individuals tested for HIV. You can't test positive for HIV if you haven't been tested in the first place. So that's one example of a validation rule. If your data entry violates a validation rule, it will be explained very clearly what rule you're violating and you'll be asked to correct that. But hopefully, most likely, you'll get a pop-up that says that your data entry form successfully passed validation and you're ready to complete. And I see that we have a question. I'll address that in just one moment. The second key step in completing your form, after running the validation on it, is to scroll down to the bottom of the page where you'll see a Complete button. Hitting the Complete button essentially saves your data entry form, data entry, as complete. So it will register in the DHIS2 database as being completed. And that will help us know when folks are entering data, when they're finalizing their data entry, and it will help us know if anybody's having any problems, if they're unable to actually register their data. Once you've hit complete, the data entry form is complete. You do not have to do any more steps. You can simply log out of the system. All right, and I see there's a question here. All right, where do you enter couples testing? That is a very good question. We have a tab here in the HIV testing and counseling data entry form called Couples Discordant Status. This is the main place that you'll enter couples testing. Here you'll see we have individuals tested for HIV in couples. And you'll be able to document if they were male, female, or transgender, and if they tested concordant negative, concordant positive, or discordant. You also enter data for couples testing in a number of different tabs. In the testing tab, for example, we have individuals tested for HIV as individuals, and we also have individuals tested for HIV in couples. And that same disaggregation appears on HIV positive results. Here we have HIV positive individuals who tested as individuals, and HIV-positive individuals who tested in couples. We just discussed couples discordant status, but in testing location and residence, we will see that we have these same distinctions. Individuals tested as individuals and individuals tested in couples. Great, glad I answered your question. All right, there are a few key points that I want to make before I open it up for questions. The first thing that I want to discuss is referrals. On every data entry form, whether it's HIV testing and counseling or contraception or sexually transmitted infections, we have two tabs dedicated to referrals. We have issued out-of-network referrals, and we have effective out-of-network referrals. An effective out-of-network referral is a documented referral, where you can say, yes, this person received the service that they were referred for. You can document referrals in a number of different ways. We're not going to get into that here. But effective referrals is what is going to be the basis for health impact estimation. So we will generate health impact estimates, or the program analytics team will generate health impact estimates based on the data you enter into effective out-of-network referrals. And that is going to be the case in 2015. Starting January 1st, 2015, the data that you enter into the Health Services Report will be used to estimate your health impact. For November and December, we are asking everyone to continue submitting data into the Health Services database and to start submitting data into this Health Services Report. We're asking you to do this so that we can completely and thoroughly test and vet the Health Services Report in the DHIS2 to make sure that your data is flowing appropriately through the system, to make sure that there are no hiccups when you start entering your data. In November and December, again, your health impact estimation will be based on data that you enter into the Health Services database, so please continue to do that. January 1st, so just 2 months from now, the Health Services database will be turned off for your country, and you'll be asked to enter data only in the Health Services Report, and that is what we will use to estimate your health impact. I hope that is as clear as possible. If there are any questions about that, please do not hesitate to raise your hand or type it in the chat box. And then I think the last point that I want to make is I wanted to address a question that was in one of the previous training sessions. Someone had asked where to submit data that they would normally submit through the CTL, which I thought was a very good question. And it's a good opportunity to point out that this does not impact how you enter data into the CTL. The CTL is not going to be impacted by this change. Any product or material exiting a PSI warehouse should continue to be reported through the CTL. Any service provided through a franchise, provided through a service delivery partner, or provided directly by PSI should be reported through the Health Services Report and in the Health Services database for November and December of 2014. All right, I think those were all the points that I wanted to cover. I'm going to take a quick look at my notes to make sure I didn't miss anything. Don't think I did. Oh, well, I guess one last thing I think that I forgot to mention is going back to referrals, and I'm sorry I didn't mention this in the first place, but going back to referrals, 2014 referrals in terms of generating health impact. The data for referrals for health impact will come from a spreadsheet that program analytics will be distributing in the next couple of weeks. This is the same thing that we did in 2013 towards the end of the year. And we're doing this so that all countries, whether or not they're using the Health Services Report, will be able to enter their referrals for 2014. So be on the lookout for that email. That spreadsheet, again, will be used for health impact estimation for referrals. And then starting January 1st, 2015, the health services report will be used to generate health impact estimations based on the data that you've entered. All right, those were the main topics that I wanted to cover. If there are any questions, I'm going to pause here for a second and allow some space so that you can ask those questions. Please feel free to raise your hand. Do not be shy. I will unmute your microphone if you like. Are there any questions whatsoever about anything that I've discussed? All right. I will take that as a, Graham, you explained this so clearly, we couldn't possibly have a question. Well done. Thank you very much for taking the time to participate in this webinar. I really appreciate it. This webinar is being recorded. We will post this, I think, hopefully on our support center if we figure out how to post a file that large. Be sure to check out the resources available in the knowledge base in the support center. If you have any questions, do not hesitate to reach out. Oh, we have a question. Oh, thank you very much. All right. That's it from me. Thank you again for participating. I really appreciate it. And I look forward to working with everyone as we start entering data. Thanks, everyone.